Hi, everybody. This is Dr. Leaf Rogers, plastic surgeon, and this is
Dr. Walter Joseph, plastic surgeon.
and this is another episode of SOMA Living, the standard of modern aesthetics living.
Yes.
And so we're going to talk today a little bit about the trends in plastic surgery and aesthetic medicine, and what that looks like today. Where is it going? What are the innovations? And basically that's going to be the topic of this podcast.
Yeah. So, I mean, we're going to kind of go over what we're seeing in our practice for you guys, kind of what our patients are coming and asking for, what we're seeing, in terms of Hollywood and
Sure, the
celebrities.
media.
Yeah, the media. So we're going to kind of touch on all that. So what are you seeing, Dr. Rogers, in terms of, the current climate?
Well, let's see. I mean, of course, one of the big trends that we can't deny is weight loss, right? So, I mean, everyone's doing the shot, right? All these GLP-1 receptor agonists and the various other types out there now, and they're very effective.
Yeah.
And I know some people think, oh, it's not good for you. Maybe it is good for you. It's like any sort of treatment. It's both.
Yeah.
Right. It really depends.
Yeah.
Depends if you're doing it with someone like following you, whether it's good for you personally, because everyone's a little bit different. I mean, there are certain situations that can aggravate. So you need someone to know that those are happening or not happening with you. But I think for the most part, they're relatively safe.
Yeah. I mean, it's a medication.
Right.
Every medication is going to have risks, is going to have benefits. Whether or not people are prescribed that medication for the exact or correct reason, can be bent a little bit.
Sure.
But I tell people that I think the overarching benefits and overwhelming benefits are kind of outweigh the risks for the most part.
For most people, I think that's true.
Yeah.
So, but the reason I bring that up, I mean, that's not directly plastic surgery, but it influences all the procedures that are being done.
Yeah.
It influences what people want and need, right? And it can influence our overall health too, which is something that we care about, especially here at SOMA.
Right. And I think that one thing that I discuss a lot with my patients is not only are you likely to look better because you're losing weight, but I think that people are attracted to the wellness aspect, which is the anti-inflammatory benefits, which all relate to things like relating to decreased risk of dementia, decreased risk of, cardiac risk factors. So
diabetes, of course.
Diabetes, all of that. And just people are seeing better lab results. And I think that ties into the whole wellness aspect of what we represent and what we are interested in for our patients.
So, but so let's talk about what are the downsides?
Yeah.
So the downsides, one thing we've seen is, people complain that they have like more loose skin or they have Ozempic face, right? Or something like that. And these are really just signs of rapid weight loss. Yeah. So if you lose weight really fast, your skin may not have time to retract. And at a certain age, it doesn't really retract much anyway.
Yeah.
And then things sag. You get more gels. You have a little bit of loose skin in your stomach or wherever it is.
Yeah.
And so that we do see more of that than I think in the past it was more lipo. Now it's more like, how do I deal with all this skin?
Yeah. Skin tightening is like the holy grail. We'll get into a little bit more of that in terms of non-surgical stuff.
Yeah.
I think that another kind of risk of the GLP-1s is some muscle wasting or muscle loss. I find that in my patients who maybe aren't diligent about going to the gym and doing weight training and who are solely relying on these products or these medications just to cut weight and just to cut fat, I think that can get a little bit dicey. Have you seen that?
Oh yeah. I mean, you can get weak.
Yeah.
You can get, like, in some cases, if you abuse it, you get like emaciated.
Right.
Which is obviously not healthy.
Yeah.
So, and then you can set you up for things like, especially if you're female, for like osteoporosis and things like that. So it's, it's a whole thing. And that's why you want someone who knows what they're doing to manage it.
Right. But I think that if you are really kind of balancing with weight training and other different, exercise, that you can mitigate that kind of muscle wasting effect that people talk about.
I agree.
Do you think so?
Yeah. Oh, no, absolutely.
Yeah.
So one of the reasons I wanted to bring that up also is because it kind of segues us into facelifts, which has become a thing. So that's like it's a trend, not to say facelifts are a new trend,
Right.
but like the way these facelifts are being done, the way they're talked about, some some techniques that are honestly not new techniques, but newly spoken about, or more, there's a new awareness, I should say, about them.
Yeah.
Yeah.
So the interesting thing is that a lot of these facelift techniques are these surgeons that are either marketing a specific technique or just popularizing the name of an older technique.
Yeah.
They're just becoming more, daily language for people. They're just dropping things like deep plane and high SMAS and, endoscopic. No one really knows what these are, except, I mean, we know what they are.
Right.
But yeah, so talk a little bit about how they've kind of just been around for a while.
Well, deep plane's been around forever.
Yeah.
I mean, the deep plane technique's been around for like 50 years.
Yeah.
So it's all that is just going under a deeper layer in your face, the SMAS, and kind of releasing it and pulling it. But it's become a little bit more mainstream, and because people have marketed it. There was one guy in particular in New York who did a lot of marketing in that technique, and it kind of blew up.
Yeah.
And because it blew up, people were asking their surgeons for it, and these surgeons like, oh, I better to learn how to do this technique. And so then they started teaching the technique more. And so we learned about it at the conferences and things. And so it has become more popular, even in the plastic surgery community, even though the technique's been around for a long time.
Yeah.
So it's a good technique.
Yeah.
It's not the only technique. There's a lot of good techniques.
Yeah. And we discuss this often amongst ourselves. If you know what looks good and you know what looks pretty and you know how to make someone look pretty, then a lot of times the technique doesn't really matter. It kind of goes out in the wash.
Yeah.
It's about,
but it's also about like, are you using the right technique for the right face?
Yeah, exactly. And because there isn't a cookie cutter, oh, this is the technique that I'm going to use for my facelifts. Is this the right face that'll lend itself to this particular technique?
So in general, just a rule of thumb, patients who tend to do well with the deep plane are those who have a lot of laxity in the front. This is what the deep plane is very good at, because it kind of pulls it and redistributes it, and it does it a little bit more efficiently.
Yeah.
So, I mean, having said that, it's a good technique.
Yeah.
But it's just like anything else. It's like breast lifts, for instance. Do you want a breast augmentation or do you need a mastopexy? And some people only do implants and they put a big implant in to make it look good. But now you've got like triple Ds. Yeah. Whereas maybe you didn't want that.
I think that's a good point. So I think a lot of it comes down to making the right diagnosis and discussing that with the patient. So a lot, if you're going for a consultation, you're seeing someone that isn't really explaining to you the diagnosis and the reason for their treatment to the diagnosis, which is their surgical technique, then they're probably either applying that cookie cutter effect or they're not really doing the right procedure that'll address your particular anatomy.
Yeah. So that part's important.
Yeah.
So other trends I see, which are also related again to weight loss, are people don't want things as big, including the breasts. They don't want as big breasts. They don't want as big bottoms.
Yep.
So BBLs like they used to be are not as popular, partially because a lot of people don't have enough fat to do it. Yeah. And partially because overall proportions are shrinking. Yeah. And because the Kardashians are all smaller too.
Yeah. So how do you reverse a BBL?
Yeah, well, Ozempic. No, it does work, but I mean, you can lipo it out, obviously, but it doesn't always look good.
Right.
But the truth is, if you had a BBL and everything was big and round, and then you lose a bunch of weight, everything's going to shrink. Yeah. So right now, I think the trend is smaller once again.
Yeah. I think too, in terms of breasts, so like breast implants, I'm definitely seeing my patients coming in asking for smaller implants.
Oh yeah.
More subtle increases in upper pole, improvements in cleavage, improvements in lower pole, things that you can accomplish, especially with like newer technology of implants, with, a couple hundred cc's without having to look like a porn star.
Yeah. Well, I mean, I've honestly been seeing that trend for quite some time now. However, I have more and more people asking for the really small breasts. I call them like ballerina breasts. Yeah. So that's become even more popular. So I actually kind of like it. I mean, I do too. I mean, not only do I personally kind of like that look, but it's just fun to see how things they change.
I think that the perception of breast implants for so long was like the Pamela Anderson, the Dolly Parton, all of these extreme examples of breast augmentation. People didn't realize that you can have a breast augmentation with a silicone breast implant and have it look cute and
Yeah.
small and pretty and doesn't have to look like a volleyball on the chest.
But of course, fat grafting too. That's
Yep.
another option.
Yep.
So if you have fat, and again, fewer and fewer people have it, but if you have enough fat, you can graft fat into the breast instead. And that's completely natural looking and feeling, and literally nobody can even tell, not even like your family doctor.
Yeah.
Yeah.
And I think one thing that we talk about with our patients for fat transfer for an augmentation is just that it likely, you will get some increase with one operation. The likelihood of needing a subsequent surgery is
it depends. Well,
depends on,
that's why you pick the 1 cup size basically.
Yeah, depends on your goal. You know, if you're trying to look like you had an augmentation, then fat transfer is probably not going to cut it alone with one surgery.
Right.
Yeah.
So, but I think part of the neat thing is not only are we talking about it, but a lot of their celebrities are talking about their own stuff.
Yeah.
Which is opening the doors to, I think, a lot of other people. I think people love to speculate. Oh, what did they have done? What, but now they actually, some of them are telling you what they have done.
That's certainly a trend. We're seeing celebrities be forthcoming about what they've had done.
I hope this happens. I hope this trend follows throughout all aspects of life. Wouldn't that be nice?
Yeah, I think so. Let's normalize, being open about, and it's not disclosing all your medical history.
No,
but it's
being real. How about that?
Being real, and it's being real about like what's obvious.
Yeah.
Right. Like, I mean, Kylie Jenner had a breast augmentation. We know that she had a breast augmentation. So she recently came out and was like, oh, these are my implant size. This is the technique. And this is my surgeon. And that's helpful for some people, but it's not always helpful. And we know that.
Right. Because just because she had a certain breast implant or a certain technique doesn't mean that's the best technique for you. So it's not like buying, I don't know, a car.
Yeah.
It's like, oh, so-and-so has this car. I want that same car. It's not the same. We're working with something with your tissues, your body, and it has to look good on your body.
Right.
And everyone's body is slightly different.
It's not a one size fits all. But what I do tell my patients is that if you tell me, or if you show me like, oh, this is the look that I'm going for. So if someone brings in a picture of Kylie and is like, oh, I'm going for this look, that helps me, but that I'm not going to just choose a 445 because that's what she had for that patient. I'm going to look at your own anatomy and then size you on the table to then give you that look based on your anatomy. But
I agree.
Yeah.
So let's talk a little bit about some of the non-invasive trends. So I think there's a lot of that too. I mean, the whole world of non-invasive aesthetic medicine has grown so much. I mean, even since I started practicing.
Yeah.
When I started practicing 20 years ago, I mean, the only laser you could get was like IPL, which isn't even a laser, and CO2 laser. And that was it.
Yeah.
But now, my gosh, we have so many lasers we've retired that are sitting in a closet. So it's kind of incredible. And some of the stuff that came out over the years was not great. Yeah. And some of it is actually really good. But it's still not just like surgery, it's not a one size fits all.
Yeah.
Like for instance, patients that just don't respond.
Yeah.
How many of those patients have we seen?
A lot.
Yeah.
Yeah.
So it's there are some technologies out there that are really good. It's just that your body, for whatever reason, just doesn't respond. Meaning it's like the company will say, oh, well, everyone gets this response, the skin tightens or whatever it is. And that may be true for most, but there are always outliers. We're all a little different. Yeah. And that's something we don't learn in med school, by the way, or even residency. We're taught like, you do this surgery and this is what you end up with. They don't tell you do this surgery and 80% of the time you end up with this. Exactly. And then 20% of the time you end up with this complication or this issue or their own. It's just because everyone's physiology a little different. How they heal is different. Yeah. It's all different.
Yeah. And I think that it's a hard discussion for us because people come in asking for these non-invasive, non-surgical options. And while they can help, it's kind of hard to have that conversation where we have to hedge the outcome. We don't know if it's definitely going to work on you. We don't know. People are like, how much improvement am I going to get? We don't know. And it is tough when you're paying for something that does not have a guarantee and is kind of literally out of our hands. Like we're not the ones doing it. You know, it's not like an operation where we might have a little more control, but we're really at the mercy of the device and your own anatomy. And I think that that's where it gets, it's a hard conversation.
It's true. And it really depends on the technology too. Some technologies are a little more reliable, meaning if you do a resurfacing, pretty much everyone's going to have skin that's been resurfaced.
Sure.
But and you can decide like, well, this patient isn't a great candidate because they might get hyperpigmentation or something, whereas somebody else wouldn't. So I think things like lasers are sometimes a little easier. Things like RF energy, I found. The rule of thumb that I have is basically a third, a third, and a third. So a third has an amazing result, like, wow, that's like almost like surgery good.
Yeah.
A third is like, man, it's a little bit, I can see some result, but not great. And a third, you see like nothing.
Right.
Yeah.
And
so within that bottom third, occasionally you have someone who has a negative result. Like they lose more fat than they get tightening. Yeah. And they're like, oh, that's actually worse.
And so like having that discussion with the patient and telling them, this series of treatments is this amount of money, but I can really only tell you that there's a 33% chance that you're going to have a significant improvement. Like it's a hard, but yet people still don't want to jump to surgery. They still don't want the downtime. They just want, people are scared. A lot of people are scared of surgery. Yeah.
Well, I mean, a little fear is healthy. It's surgery. I mean, you know, we're injuring you to make you look better. So I mean, it's kind of a odd like concept. Right. But I mean, it's more reliable most of the time.
Right.
So I mean, having said that, these things don't work perfectly for everybody. Oh, one thing I do want to say is that we can sometimes predict better. Like if you've had a procedure done before, like one of these treatments, and you had a good response. Then you're more likely to get a good response, especially with that type of energy. So, and there are some other trends too, like certain ethnic groups, because, you know, genetically speaking, there are some trends ethnically that certain groups respond a certain way to certain types of energy. So I have found that I'm a little bit better at predicting for certain people based on their personal history and sometimes their ethnic makeup.
And I think that comes a lot with experience. And so that's another reason to, you know, if you're going to see a practitioner at some med spa where they really haven't done a lot of treatments with a particular device, then they might, that could be misleading to the patient. Right. And so I think that seeing a provider that has a lot of experience with a certain type of treatments, whether it's RF or laser energy, you know, then they'll be able to predict the outcome the best.
And also it's based on the settings too. So I've seen quite a few patients from other practices where they've come to me where like, you know, I had this bad result and it's almost always because the settings weren't quite right. They treated like the wrong layer of tissues or too much energy or whatever, it was the wrong part of the body. So that's, again, that comes with experience. So, but having said that, you know, talked about like who's going to get a result, let's talk about like the actual like new stuff. What's trendy? So what have you seen is the most trendy, at least the stuff that we have exposure to? What do you think is trendy?
So I'm having a lot of patients come in asking for the salmon sperm. So PDRN or polydeoxyribonucleotides. So what is that? What's the deal with that?
Well, I mean, that was interesting. That was popularized. Who's the one who posted about that? That wasn't a Kardashian, was it?
I think Kim K posted it. Jennifer Aniston posted it. Those are kind of two of the kind of more prominent names where they were getting microneedling, microneedling's been around forever. And microneedling's great. I think that's
pretty low risk.
Extremely low risk. I think high reward. And so what they were doing in addition to the microneedling was using this serum, which has a compound in it that's from salmon sperm.
It's not actually salmon
sperm. It's not actually salmon sperm.
It's a component of, and I think some of them are now synthetic.
Or some people say salmon DNA.
It's basically DNA.
And so that is used as a glide over microneedling. So we're using that to needle into the top layer of the skin, just a millimeter or two at the most. And people are seeing a really nice glow shortly after, you know, all those, after you heal from that microneedling.
It tends to plump the skin a little bit.
Plumps the skin, smooths, really kind of evens out the complexion.
As far as I know, I don't think anyone knows why.
We don't.
I don't know why.
I don't
think there's any good research out there that gives us a good answer as to why it works.
In terms of the actual mechanism of action. Yeah.
So we'll figure that out eventually.
Yeah.
At the moment, but that's part of the reason why you're not allowed to inject it, because the FDA doesn't really
don't really know the mechanism.
Right.
But we do know, and I see that it works.
Yeah.
My patients see that it works. That's why I have patients that come back literally almost every 6 weeks for that treatment, microneedling with salmon DNA.
Yeah. And that's kind of like in the same vein as like exosomes and all that other stuff. And now I think a new product just came out, relatively new. It was PDGF.
Yes. Right? Yeah. The
platelet,
PDGF controversy.
Platelet-derived growth factor.
Yeah.
So that's one of the main growth factors that you get out of platelets for PRP, which is platelet-rich plasma, which I think a lot of people out there probably know about at this point.
Yeah.
That's when you draw your own blood, you spin it down, get the blood out, and then you get the PRP portion, and you can inject it or give it back to you in many different ways. It's good for inflammation. But now they just took that one growth factor. PRP has a bunch of different. This is probably the main one, and you can get that as an isolate.
Yeah.
And it's recombinant, meaning it's human.
Originally,
genetically, but humans it's not from humans.
Yeah.
Bacteria make it, and that's how they make like insulin and all these other things. Days.
I think what's cool about the PDGF idea is that one thing that we've seen or know about with PRP is that PRP can be a little bit contingent on the protoplasm of the patient, right? So depending on how healthy you are, how clean of a lifestyle you have, your age, all of that,
your platelet number,
all of that, those factors can have an effect on your blood and therefore on your plasma and therefore on your PRP.
How effective it is.
Right. And so it's kind of eliminating all those kind of black box things. And so that's like when patients ask me, okay, so which should I do? Should I do the PRP or should I do the PDGF, or, should I do exosomes or should I do PRP? So that's where I kind of try to explain to them that, listen, if you want kind of a more guaranteed off the shelf, this is what I'm going to get, then things like the PDGF, literally off the shelf PDGF can be great.
And the concentrations of the PDGF are really high.
Yeah.
So it's higher than you would get for PRP.
Yeah.
So I think that's a neat one. I think that one is going to have a bright future.
Yeah.
But there's been a little bit of bad press, right?
Yeah. So some of the controversy. So I've seen a lot of different before and afters, and some out to like 6 months, where some people are developing these skin nodules that are hard and visible in the area that the PDGF was injected.
And by the way, you're not supposed to inject it. You're supposed to needle it in.
Right.
Yeah.
So it's just like I talked about with the salmon DNA. Technically, it's supposed to be microneedled in. People are injecting it. I think that's when they're seeing more of those issues.
And that's probably just as too high of a concentration. You had a reaction, whatever. I mean, that's not a great outcome. However, I don't think that indicates a bad product. It just means there needs to be a little more education.
Right.
Maybe you figure out how to use it properly.
Right.
Any new thing that comes out, there's always going to be a learning curve, and there's going to be some missteps.
Yeah.
You just try to go to a place where there's going to be fewer missteps or not one for you.
Yeah. I mean, every single thing in the past, whether it's Sculptra or HA fillers or even all the neurotoxins, there's always going to be little outlier complications. That's just the reality of these things, right?
And the good thing is it's temporary. I mean, even 6 months is a long time, but I'm sure that's a very much of an outlier story.
Yeah.
Yeah. So what about the energy technologies? Are there any new ones? There's a new one that did we get it?
It's coming this week.
Yeah, we keep hearing that. So there's one, it's the company is Cynosure, right?
Yep.
So Cynosure Neutronic, right? And it's called ZERF. Yeah. So it's sounds like Nerf, football, but with an X, right?
Yeah.
Okay.
So the Z is an X, XERF, yeah.
So tell them, why is this one different and why it has a potential to be a new trend?
Yeah. So typically almost every RF device is 6.7 hertz and goes to a certain depth in the skin. So what's different about this RF device is it has 2 different frequencies of radio frequency, 2 hertz and the 6.7 hertz. So it's targeting 2 different depths, and that 2 hertz depth, which is the newer depth, is going deeper into what we call the SMAS of the face, or kind of the deep muscular layer of the face. And also part of the face that becomes lax with time is we have these like retaining ligaments and these, what we call these fibrous septa, that kind of hold our tissues in place and connect kind of the deeper structures to our skin.
What we're addressing with the deep plane facelift.
Exactly. Yeah. So if we can, they're almost like if you think of the the tufts on like a tufted couch.
Yeah.
So when those stretch out, you know, you lose like that tufting, and that's what kind of creates
Like
laxity.
when the button
Or
falls
like a
off.
little, like a little seam.
Yeah.
And so if we're able to tighten that up, then you tighten skin and lift skin. So that deeper frequency is getting into that.
So normally I'd be worried that you'd lose volume fat.
Yeah.
So they have a solution for that, right?
Yeah. So they're saying that one, like their cooling mechanism, and two, they actually just did a test. I don't even know if I told you about this. So they did a test on an abdominoplasty specimen. So on a chunk of fat and skin. And they put it on the deep setting and the highest, which is 10.
Okay.
And they did it 10 times.
Okay.
And they saw no change in tissue thickness.
Huh, interesting.
So it's doing, you know, in terms of debulking, say like the submentum, they're saying that you're actually lifting the tissues up, and that's what's causing like the improvement in contour. It's not really changing the fat.
Right.
Which
so it's the cooling cycles, and also it's pulses.
Pulses.
Yeah. So it's pulse energy versus
it's like a very specific, when you use the device, there's very specific patterns that you can hear the RF going for each setting. So there are 3 settings, shallow, mid, and deep.
Yeah.
And each one uses different frequencies and different pulses. So
it'll be interesting. I mean, I'm eager to get my hands on it. It was launched originally in South Korea, which it apparently did really well. And then in Canada, where it also did well. So now we're going to be one of the first to get in the US.
We're excited.
Yeah. So that'll be fun.
Yeah.
Okay. So what's next? What's next is in terms of all right. So what else is trendy?
Yeah.
So I mean, I think one of the things obviously trending is the whole longevity thing.
Yeah.
So and that, you know, it dovetails into aesthetics, because obviously when you are healthier, you tend to look better. And then it's often it's the same person who wants to look good and to feel good and to live long. And so that people who actually care about their health, which just should be all of us, honestly. But, but you know, the longevity thing has been very popular in like online. So all these podcasts have become very, very popular based on that stuff.
Yeah.
Like Huberman Lab, for instance, is like humongous.
Huge.
So, and that's pretty much all he talks about is like longevity, wellness, all these things. So I still think, my personal opinion is, I still think it's a little bit early. So I don't mean early meaning you shouldn't do it. I mean early because it's such a new thing. It hasn't really caught hold the way I think it's going to catch hold, if you know what I mean.
Yeah.
It's like med spa was in the very beginning. I mean, med spa was like, oh, you do a little Botox here and there, but now it's like everywhere and everything. I think that is the future of longevity and wellness. We're just not quite there yet.
Yeah. I think one thing that we're seeing is that younger people are hopping on to these trends, which is a good thing, and I think carries some risk too. I think that what we are seeing, though, is, say, a lot of the A-list media. I think they are doing a lot of these wellness trends or techniques and kind of these biohacking things. And I think it is making a difference, not just on their inside, but on their outside. Like celebrities like Lindsay Lohan, you know, who clearly had a different past than where she's at now. And that probably in and of itself was a huge factor in her looking as good as she does now. I think that in combined with all these non-surgical modalities and maybe a little surgery too sprinkled in.
Well, I mean, this is where it starts crossing over because longevity and wellness and regenerative medicine is really just a continuum.
Yeah.
So it's
and aesthetics. It's like
of course. Yeah. And so but regenerative medicine, we already spoke a little bit about it. Like the things like PDRN are technically crossing over to regenerative medicine. Yeah. Exosomes, PDGF. I mean, there's a product called Renuva, which is it's like a collagen matrix, and then your fat cells basically grow into it. It grows new fat cells, which is kind of amazing. Yep. But all this is regenerative, and this is we're just barely scratching the surface of what is going to be possible. Yeah. Part of it is we just don't know enough yet. We're learning. Yeah. But if you just go online and look at some of these, like, you know, PubMed. So if you just go on and look at PubMed, for instance, do searches for some of these things, it's really impressive how many papers have been published on all kinds of regenerative medicine. Right. Yeah. And this will affect us in terms of our lifespan and our quality of life. It will.
Yeah. And I think that too, that and combined with some getting involved in some of these, non-surgical procedures early on, I think that's why these younger generations are looking so good and looking natural and kind of just getting ahead of the aging process. People are like, what did they do, or why do they look so good? I think truly a lot of it is coming down to the wellness and the longevity stuff and a lot of the non-surgical stuff. I think little tweaks along the road and making these little lifestyle changes and incorporating a lot of these biohacking techniques make more of a difference in concert than people think.
That, and I think just in terms of the aesthetic medicine community, in terms of the professionals out there, I think we're becoming more sophisticated.
That's true.
So I think our eye is getting better. Instead of just saying you need big cheekbones and lips, it's more like, how do we harmonize the face?
Yeah.
I mean, we've been saying that kind of stuff for a long time, but I think we're actually gotten to the point where there's some of us out there have really gotten to the point where we're really skilled at doing it.
Yeah. I think it's exciting. And I think that people are looking great. And I think we're moving away from that cartoonish, overdone look, right?
Well, as the waists aren't as small and the butts aren't as big, right? The caricature sort of look is shrinking.
Yeah.
So I think that's applying to everything. Everything's kind of getting toned down, looking a little bit more, for the sake of what am I going to say? What's the word? How do you say it when you can't think of the word? Lack of a better word. Yeah.
Yeah.
So in lack of a better word, things are looking a little more normal.
Yeah. Yeah. And I think it looks good.
Yeah, no, I do too. No, I do too. I mean, natural beauty really is the best beauty.
Right.
I mean, yes, caricature beauty is fun, but do you really want to be like that all the time?
Yeah.
I mean, that's what, makeup and, fancy dresses are for, right? For me, it's not something you want to wake up in the morning and see every single day, and this is who you are. For me, that doesn't make sense, but to each their own.
People are calling it kind of like an undetectable plastic surgery or undetectable beauty era or whatever, but I don't love that term because I think it is important to detect it and see that there is a improvement and people are looking rejuvenated and younger. And so I don't think that's undetectable. I think that's noticeable, but it's just, I don't know, it's just natural.
Well, the way I see it is a lot of the stuff you look better, but people don't know why.
Right.
But we're getting better and better at figuring out why.
Yeah.
I think that all of society is looking online all the time at all these people who've had stuff done. They're like, okay, I know what that person. Oh, you see a subtle difference.
Oh my gosh, I know. Everyone thinks, and it's always the extreme. Yeah. I think so many, at least what I see on the internet, people are like, oh, this young person got a full facelift and her nose done and a blepharoplasty. And I think the internet like over assumes or.
Oh, yeah. I mean, it's clickbait though, right?
Yeah.
But I have to admit the Kris Jenner.
Yeah.
So Kris Jenner's like before and after was clickbait, but in a not this traditional sense.
Right.
It was like, wow, look at that. She looks really good.
Yeah. And what I liked about her kind of evolution is that she has been very transparent. She was like, this was I think my third facelift or, so she had another revision facelift, and there's nothing wrong with that. And we tell our patients, people always ask us, how long is this one going to last? And we usually tell them, we're not stopping. I always say, I'm not stopping the clock. I'm just resetting the clock. The clock keeps ticking immediately after you leave the operating room. Yeah. But you're going to look great for probably close to 10 years, maybe longer, but it's all about like how your standard measures up to that.
Of course.
You may want to get a touch up in 7 years, who knows?
Or maybe 3 years.
Right.
I mean, if your new standard is like as close to perfection as humanly possible, maybe tomorrow.
Yeah.
Yeah.
But I mean, in the sense too with Kris Jenner. So I mean, that was great that she was forthcoming about, the revisions and whatnot. But I think it's transformations like say like Anne Hathaway. Like that was another one where she showed up and people were like, oh my God, she looks amazing. What did she do? Yeah. And I think those where even we have trouble figuring it all out and like, wow, like, what is it?
Uh-huh.
Those are the ones that I think are cool and exciting.
Yeah. Well, we'll do a whole. We should do a whole episode on that.
Yeah.
We'll be very. So one thing I hate doing is picking people apart and being like, oh yeah, this done. But I think that we should pick the people who look good and say, try to figure out if they've had anything done. What do you think? What do we think they've had done?
Yeah.
And obviously this is speculation.
Yeah.
We would never pick on somebody we did.
And it's all for education and, demystifying. It's not to. Yeah.
And it's all complimentary, by the way.
Yeah.
So one other thing that I think is trending, and it's been around for a bit, but it's even more so now, is the whole concierge medicine phase. So, and that, again, that's something we have here as part of SOMA, and part of that is because the longevity aspect. So the wellness and longevity aspects, those are things that you do need someone to take care of you, or at least monitor you while you're doing them to do it right.
Yeah.
And it's just a lot easier when it's a concierge doctor. I mean, I think these big like, like, how do I explain? They're like almost like mills from internal medicine.
Yeah.
It's difficult because like there's these online things and like, yes, they say, oh, go to your lab, submit it, whatever. But it's hard to have someone really follow you properly. And I'm not saying they're all bad. And I think if you need something minimal, it's probably fine as long as they're catching everything.
Yeah.
I do think that once AI is part of this, it'll get better. I mean, it's not going to be the personal touch, but at least AI is going to be pretty good at not missing stuff.
Yeah.
So I think that is going to be the future.
Yeah. And I think people with all of these new wellness innovations and developments, I think we touched on this a little bit, but people don't want to feel like they're going to the doctor when they're going to the doctor.
It's
like,
true. That's true.
They want to feel like they're in the future and they want to feel like they are getting pampered. So it's like this interesting crossover of kind of like what we talked about last time, like vanity and medicine and wellness kind of all merging together and I think that's where like the concierge medicine and like the luxury, wellness facilities are doing well in.
I mean, ultimately, I think you want the experience to be a pleasant one, not one that you're like, oh, I gotta do this.
Right.
So, because truth is, if you like are dreading doing it, most people are just not going to do it.
Right. Yeah, you have to want to do it.
Yeah. And it's easier to want to do it when it's fun.
Yeah. And when you're in a nice place.
Yeah, exactly.
With good people.
Yeah.
So.
And one last trend that I just mentioned already, but I'm going to reiterate, is AI. Now, of course, AI, everyone knows AI is here. It's not going anywhere. AI is definitely going to change medicine. This is a new trend that's just barely starting to really to cross over into the world of medicine. I mean, it's done in like radiology and stuff like that in a big way, but I think we're going to start seeing it everywhere in medicine.
Yeah.
Now it's not going to take over surgery yet, but I know that people are working on it.
Yeah. Yeah.
So probably in my lifetime, it'll start crossing over into surgery and
I think in skincare, we're going to start to see it first. We're already seeing it to some extent in, devices or computers that are analyzing the skin and proposing different, treatments in that sense.
Yeah, I think like when you get these giant panels and stuff, I think it's really good at observing, like seeing like how things link together.
Yeah.
I mean, obviously a good practitioner can see those things too, but this is one way to do it in mass. So once those are in place, I do think that like, the mass type of medicine will be more effective.
Yeah.
I think just little things like making appointments with doctors. It's already in place for that. That works pretty well.
It's just streamlining the process, making it easier for the patient.
Yeah. I just hope we don't get too lazy.
I know. Yeah.
Well,
it's true.
I mean, I think that's pretty good for an episode. I'm sure you guys are probably at your limit as to what you can listen to for us talking. So we'll end it here today. So this has been another episode of SOMA Living. And for those who didn't see the first portion of this, I mean, you should go back and listen. This is all about the trends in medicine and health and aesthetics in general.
Yeah.
And we will have another episode very shortly. And
we're going to discuss a little of men's sexual health.
Yeah, that's the next one.
Yeah.
See you guys soon.
See ya.